Thank you so much for joining us today and being part of this public health conversation series. My name is Dr. Esther Tan. I am the Senior Medical Officer in charge of public health issues at the UN here in the headquarters in New York. And as you probably know, this meeting is really part of our regular public health conversation series. So once every few weeks, we try to invite speakers to come and speak about interesting topics, public health promotion topics. But for today, we thought that we would focus on Mpox, just because the WHO declared it to be an emergency of international concern. And we thought that's a good idea for many people to know more about this Mpox outbreak. So that's why I will be personally sharing today about the outbreak. And feel free to ask any questions in the chat stream. If you're interested to sign up for future such briefings, this is completely open to all UN staff. You can just sign up. We put it on the chat. You can just fill out the form and you'll get into our mailing list for future briefings like this. Okay, so let me start. So for today, we have maybe about 45 to 50 minutes. I'm going to try to leave some time for question and answer at the end as well. So there's quite a lot to get through, but you're going to have the recording if you need to listen a bit more closely to anything. So just to say that I will be covering the background of monkeypox, or Mpox as we call it now, a situation update of what's happening globally and what's happening locally in Africa, and more details about the disease, what the UN is doing from our perspective here in the headquarters, and as well as covering a little bit about the risk mitigation plan that we've put together that you can also look up online after this. And then we'll go to question and answers later. Okay, so what is monkeypox? So we're now calling it Mpox, but it's also monkeypox, and it is part of it's a zoonotic disease, and it is part of the genus of orthopox viruses. And a close cousin is actually smallpox as well. So smallpox is also an orthopox. So originally this was discovered in monkeys. However, in 2022, in order to avoid any stigmatization of animals or people, the name was changed to Mpox. So from now on, I'll refer to it as Mpox. So Mpox can cause an infection that may have a fever and a painful rash, and it can spread from person to person, although it's important to remember that this is a mostly mild disease. So as you're aware, in August 24, the WHO declared that this is a public health emergency of international concern, and this is due to the recent upsurge in late 2023 of Mpox cases in the African region, especially in the DRC. The spread of cases in the DRC was attributed to two different outbreaks. One was the Mpox clade 1A, and the other was clade 1B. So this spread and this upsurge of cases caused the WHO to want to put the international community together, and they declared this public health emergency of international concern. So just a quick history of monkeypox outbreaks. This virus was first isolated in 1950s, and it was isolated from laboratory monkeys that were used for experiments on polio. But essentially, they found that these monkeys had these kind of pox rashes, and so they isolated this new Mpox virus from these monkeys. So from 50s to the 70s, it was basically a disease of animals. But in the 1970s, they found it, they isolated it from a human, from a child in the DRC. And it could be, the exposure could be due to playing with the animals that have these Mpox. We'll talk a little bit more about that later. And then subsequently, there started to be more and more cases in humans, at first kind of sporadic cases in Africa. And actually in 2003, there was an outbreak outside of Africa in the United States of 81 cases. And this was actually linked to prairie dogs. So some people in the US, they would buy these exotic animals, prairie dogs, and they were closely housed with um, rats or rodents, wild rodents that had the Mpox. So that was how it was transmitted then in 2003. In 2017, 2019, there was also outbreak of more than 300 human cases in Nigeria, more sporadic cases throughout. Whatever it is, it's always been in DRC. So it's always been endemic within the Central African region. In 2022, 2023, you may have heard that there was this worldwide epidemic. So it came out of the African region and was in places that usually don't have Mpox. So in America and Europe, total about 90,000 cases. And then now we have this late 2023, we have this outbreak in the DRC with this different subtype. I'll explain a little bit more about that later. So again, this is the same history, basically how it kind of developed from just isolated from an animal to now a global outbreak. A quick word about the transmission cycle. So it is thought that the host or the reservoir of this virus is in wild rodents or small animals in the African region. And it potentially can spread to primates like monkeys, for example. That can be one of the hosts that host the virus. And then from these, animals, whether it's small animals or primates, it can come to humans through exposure, through contact, for example, eating these animals, hunting the animals, exposure, to these animals. And then from there, as humans, more and more humans get the virus, they start having these human-to-human transmission, and that's why now we have more and more of these community transmission outbreaks within the human community. I just want to explain a little bit about the two different types of Mpox. So there is clade 1 and clade 2. Clade 1 tends to be more in the Central African region, and clade 2 is more in the Western Africa region. Clade 1 was thought to be, has a higher mortality rate, more infectious, whereas clade 2 tends to be less severe disease, less mortality rate, and less infectious as well. So you can see that clade 1 and clade 2 actually both have subtypes. So there is a clade 1A and there's a clade 1B, and there's also clade 2A and clade 2B as well. So each of these have kind of different, some slightly different characteristics, but the outbreak in 2022 and 2023 in Europe and America was more clade 2B. So it's the less severe outbreak, less transmissible type of outbreak. Whereas now the clade 1B, that it's very concerning to us, is really slightly more higher mortality rate, more easily transmittable. And that's the one that we're more worried about, the clade 1B currently. So I'll just move on to the situation currently globally and then later on to Africa. So this is a global situation map of the Mpox reports that we're receiving right now to the WHO. And as you can see, it is split up by different clades. And so this darker blue is where the clade 1 is. And then the lighter green color is where the clade 2 is. So you can see that, which is what I explained just now, that the clade 1 is more in Central Africa, and that's the more worrying clade right now. It's also worrying because it's starting to spread across the borders of DRC. It's going into Burundi, Rwanda, Uganda, Kenya. So that's the reason for the declaration of the PHEIC by WHO. So within Africa itself, since 2022 until September, there's been about 6,300 lab confirmed cases, including 54 deaths reported from 20 countries across Africa. But a lot of these were actually in the more recent years. So in 2024, out of those 6,000, 4,000 were reported more recently, including 32 deaths. Having said that, just to say that these are only the lab confirmed cases, and so obviously there are many cases that may not be reported. Maybe they were not tested. So it's hard to know the true number, but these at least are what we have confirmed through lab testing. Again, this is the same thing, but it's just concentrated in Africa and the outbreak status in Africa, where you can see that the red is where there's active transmission cases reported in the last month. And you can see that, again, it's concentrated right now. And this is the same thing where the different clades are being reported, again, from more centered around DRC and surrounding areas. This shows the epi curve of Mpox in general in the region. And you can see again, this is from January 22 until now, September 24. And you can see, more recent cases being identified in many of these countries. The red is DRC. So right now it's still predominantly within the DRC area. Okay, so now I'm going to move on to the disease and what the disease looks like and what you should know about it. So it's important to really understand kind of what the signs and symptoms are. So the most important sign really is the rash. But there's some people that before the rash starts, maybe between 1 to 4 days, they can also get like a flu-like illness, like fever, chills, aches and pains. Some people also get kind of swollen lymph nodes around the neck, around the groin or armpit area. You can also potentially get cough, sore throat, but the most important thing is really this rash. And typically this rash starts in the face and then can spread to different parts of the body, including the palms and the soles of the feet. And the rash differs in terms of quantity. Some people get just a few rashes, some get a lot. So it's not uniform like that. This is what some of the rashes might look like. Typically, it start off with kind of a flat reddish rash, and then it starts to become like a pimple, and then there starts to be a umbilicus in the center, and then it craters in. And you can see kind of, after this is like the pimple, it craters in. And then it starts to scab over, and then new skin starts to form. So once the new skin form, then you're out of the kind of infectious stage. So the virus lives a lot in these rashes, in these blisters and bumps. So, people with Mpox should cover these up so as not to spread. But when this new skin is formed, when it's scabbed over and is dropped off, then that's when the person's out of that infectious stage. Okay, how can it spread? It spreads through close skin-to-skin contact. It also spreads through sexual activity as well. Obviously, there's a lot of skin-to-skin contact in sexual activity. Obviously, a direct contact with someone with Mpox, the body fluids of somebody with Mpox. But also if you use the clothing, bedding, towels contaminated by someone with Mpox. The other thing that can spread is from a pregnant woman to the virus within her fetus as well. Again, just to stress that some people have the flu-like symptoms before the rash, but some people have only the rash as well without any of the fever or anything like that. So given what we know about how it spreads, these are the kind of activities that we should avoid. So we should avoid close contact with someone with Mpox, obviously, close skin-to-skin contact with them, sexual activity with them, and sharing objects with someone with Mpox. Just general precaution, you want to wash your hands with soap and water or hand sanitizers. And just a reminder that A person with Mpox can spread it from others from the time that the symptoms start until the time that the rash has fully healed. So the illness itself, someone who is sick with Mpox typically will last for 2 to 4 weeks, and most people will recover fully. So this is a disease that is mainly mild, can be managed at home, and with some care, it will not spread to other people. So just a reminder that this is not a highly fatal disease. Majority of people get disease. It will be just mild. Okay, what to do if you have Mpox infection or you suspect you have, you should straight away self-isolate. And you should be self-isolating until you don't have a fever for at least 72 hours. You don't have any type of symptoms that I described just now. You have no lesions in the last 48 hours on your skin, and all your skin lesions have scabbed over and there's a fresh layer of skin, okay? So if you meet those criteria, then you can stop self-isolating. Okay, a lot of questions are often around vaccines and treatment. So just to say that, yes, there is vaccines against monkeypox. These were actually vaccines that's developed for smallpox. There are two. There's the ACAM 2000 and the JY Neos. It could be called something different in different countries. But right now, just to say that this vaccine is in limited supply in certain countries. Certain countries have more of it than others. And the WHO, obviously, by declaring it as a public health emergency of international concern, the idea also was to encourage countries and manufacturers to start looking into making more vaccines for this disease. In terms of the efficacy of the vaccine, because a lot of people ask this question, there's not been very good studies, like we don't have a randomized control study around this vaccine, but based on some case control studies, it's shown that the vaccine, if you take the full course, this vaccine comes in 2 doses. So you have to take one first dose and then wait 28 days for the second dose. So if you take the full course, it can be around 70% effective. If you only take one dose, it's about 30% effective, according to the studies. But it is not clear how long the vaccine protection can last for. In terms of treatment, right now there is no direct treatment. So there was a recent study made of an antiviral called Tpox, and however, it didn't show to work. So any antiviral treatment is right now going to be experimental right now, if recommended by doctors or anything. So there's no real treatment. So the only thing that you can do is supportive care and relieving the symptoms. In terms of symptoms, the rash tends to be sometimes painful and itchy. So those are the things that need to be taken care of, like the pain and the itch around these rashes. Obviously, the most important thing that we can do is to isolate such people to reduce the spread. Okay, so that's the first part of my presentation. I'm going to move on now a little bit to talk about the United Nations approach and what we've done, and then also talk a little bit about our risk mitigation plan that we already have online. I won't go through a lot of detail because it kind of cover information for different groups, but you can find it online in this website if you want to. So just to say that to date, what we have done in the UN is obviously we're looking and monitoring the whole global situation. We are looking at whether there are cases among the UN family as well. We have started training of the UN healthcare workers. We have started some discussions about how we can get vaccine access if needed. Right now, I would recommend that if you are in a local duty station that has the Mpox, most likely the best source of the supply is going to be the local health department, local health authorities alongside WHO. So we are encouraging our duty stations that have the Mpox endemic in their country or an outbreak in their country, that they have to get in touch with the local WHO office and just make them aware that they're also working. They have healthcare workers, or they have high-risk groups as well, to be able to get access to the vaccine. Right now, we in the UN centrally, we don't have the vaccine for UN staff as such. Okay. Again, we've issued guidelines on Mpox for these high risk duty stations, including DRC and surrounding areas. We have done special training of the healthcare workers. We're doing tabletop exercises for them, with them, and then we're also coming up with clinical checklists for their clinics as well. We're also working to ensure that they have access to necessary PPE and other items. And of course, we're doing sensitization and awareness raising for UN personnel. So, we've put out broadcasts and this meeting, this presentation is an example of the awareness raising that we want to do with all UN personnel at large. Okay, so now I'll move on to the details of the UN Medical Director's Mpox Risk Mitigation Plan. It's all spelled out in a document that you can have a look and kind of download and look through yourself. But essentially, the way this document is drafted is that we have different categories that we have instructions for. So one broad category would be all UN personnel. So UN personnel should know what are the risk factors, for example? So risk factors would be if you have close contact with an Mpox case, if you men with sex with men, gay, bisexual men, and have sexual activity as well with these high risk groups. Household transmission as well. Right now in DRC, a lot of children tend to be affected as well. And then how is it transmitted? I've explained that before as well, and then how to prevent the disease as well from spreading. You should know all these signs and symptoms and what to do. If you have them, you should seek medical attention, obviously. Again, just a reminder that most people with Mpox, it's a mild disease, a self-limiting disease. And also just a reminder that mass vaccination across the board is not recommended. Right now, it's really recommended mainly for the high-risk population, which WHO has stipulated, includes healthcare workers that work with Mpox patients, laboratory workers who are testing for the Mpox virus, and then also, for example, sex workers, household contacts of people with Mpox virus. The vaccines are limited currently, so especially in the DRC, for example, the allocation will be by priority groups according to WHO's allocation. Again, the UN personnel with some specific, in some specific categories may be at risk for more complications. So people who are immunocompromised, for example, pregnant or breastfeeding women, and again, children below 8 years old may have a higher risk for more severe disease. In our document as well, we talk about, what to do if you're a contact of a case. So a contact is really defined as someone who has exposure to a probable or confirmed case. And the exposure could be, again, skin to skin, skin to mucosal contact, contact with contaminated materials of individual with Mpox. In terms of respiratory exposure, so this disease is not something that is airborne as such, like traveling long distance through air. So you need very long, a few hours exposure to someone at close proximity. So potentially, if their saliva could hit your, your mouth, your eyes, something like that. So this is how that could be exposure. But again, just to say that this is not a disease that is is spreading through the air in that case, okay? So if you're a contact of an Mpox case, you should monitor or self-monitor yourself for 21 days. And when we say 21 days, it's because that's the maximum incubation period of Mpox. So incubation period just means that the time that you expose to the virus to the time that it can show as signs and symptoms. So that's why this 21 days period is important for you to monitor yourself. You can go about your life as normal because you have no signs and symptoms. But the minute you have any signs and symptoms, you need to isolate yourself, okay? So if you're an asymptomatic contact, yeah, you shouldn't, just to say, you shouldn't be donating blood, tissue, breast milk or semen at this time. You shouldn't have any non-essential travel, but there's no need to quarantine or have any specific work restriction if you're asymptomatic. For UN care workers, we have kind of specific instruction for them. And so we have separate kind of training and briefing for them. But these are the kind of things that they should be aware of as UN healthcare workers. And again, it's just a repeat of what I explained just now, the stages of the Mpox rash. It starts off, as a flat rash, then becomes like a pimple-like, and then you have a umbilicus in the center, starts to crater in, it starts to have an ulceration in the center, it starts to cross, and then it starts to crust over, and then the new skin starts to be formed over. So Mpox can be similar to other types of disease like herpes, shingles, syphilis, chickenpox. So, you do need a healthcare provider to help you figure out whether it could be Mpox. But in all cases, you should test for it as well. And the testing is through swabbing the lesion. So a swab will be taken off your skin lesion and then sent to the lab for a specialized lab to be tested to see whether it is the Mpox virus or not. Again, we have recommendations for what the UN healthcare workers need to know. They need to isolate the patient properly. They need to, when they see the patient, they need to put on special protective gear and how to remove it as well. There are instructions there, how to collect the samples, talks about vaccinations, who to vaccinate. We also have another category for cleaners in a healthcare setting. They should obviously follow proper protocol when dealing with any of the linen or the materials related to Mpox patients. And then also we have a section for personnel who's living in kind of what we call congregate living settings, like for example, military people in a barracks, which is very crowded, for example. So that's what's called congregate living settings. So we need to emphasize hand hygiene, need to cover lesions where possible, and adhere to any cleaning, disinfection protocols, launder the materials properly, separately. So again, we have all this information there for people who live in such settings, especially like the military barracks kind of setting up, peacekeepers. So if you are a UN personnel that has you're suspected to have a Mpox case or confirm a probable Mpox case, again, you should just immediately isolate. You should immediately get tested to see if you have the Mpox virus. And again, you should remain isolated until all your lesions are crusted over, no new lesions are seen, the scabs have fallen over, fresh layer of skin over, okay? And then lastly, we have also a section for personnel who are planning to travel. Obviously, if you have signs and symptoms compatible with Mpox, you shouldn't travel. If you're a known contact of a known case, you also shouldn't travel. Having said all this, WHO does not advise any form of travel restriction in any way apart from those things that I mentioned. Okay, we have a lot of additional resources as well in our risk mitigation plan. And we have a standalone webpage that we put in UN documents related to Mpox, so you can find it on this page. Okay, so now we can turn to the question time. And if any of you have any questions, please feel free to put it in the chat. And thank you for your time. And if you're interested, you can also just email us if you have any questions. And we'll put the email address there so that you have that as well. Okay, so I'm going to just start from the top for questions. And my colleague, Dr. Fowler, is online as well, helping to answer any questions as well. Let's see. So let me just. Yes, and all of this will be shared. If you registered for this, all of us will, you get a copy of the video and the slides as well. Okay. Okay, so question, why are some diseases deadly? Sorry, like Ebola. So as Dr. Fowler mentioned, yeah, this is very much related to like the virus itself, the characteristic of the virus, and also, who it tends to impact, infect, and also obviously the characteristics of the person acquiring as well. So, for example, correct, Ebola is a good example. Ebola has very high case fatality rate, different from Mpox, but this is really related to the virus characteristics. Okay, other questions? Can you say something about taking care of a person with Mpox at home? Yes. So basically, what you want to do is you want to make sure that you are protected from skin to skin contact with the patient. So some of the things that you might need might include gloves. It's better that you wear a mask as well. As I explained that, if the kind of the saliva, if you're speaking closely, the saliva can kind of at close contact, come into your mucosal surfaces. So in the healthcare setting, we actually also recommend things like eye protection and like a apron. But essentially, you just want to create a barrier between you and touching the skin, the lesions of the patient. That's what you want to try to do. Okay. And as well as all the proper care, the laundering, the disinfection of the environment as well, and the items as well. A question about vaccination. So is it mandatory? So yes, so vaccination, generally mass vaccination is not recommended for now. It's just the high risk groups that are recommended. Okay. Um, yes, so yeah, someone mentioned that it's been called monkeypox in the 70s, but WHO now recommends the change to Mpox. So correct, we should be calling it Mpox. Okay. Um, People with HIV, yes, people with HIV would be considered part of the high risk group, especially if they're not on antiretrovirals. That's very, very important. They're gonna get complicated disease. So that's really very important. Um, with the advice of self-isolation, what do we do with suspected symptomatic cases or asymptomatic cases of confirmed cases in relation to their travel plan, sick leave entitlement? So I think Dr. Pran, you asked that. So basically, I think in terms of isolation, for sure, if you're a case, right, with signs and symptoms, you're going to go on sick leave. You have to be isolated. You're sick, right? So if you are a symptomatic, and whether you're suspect case or lab confirmed case, as long as you have these symptoms, you're going to be going on sick leave, right? Because you have these rashes, maybe you have the fever as well, so you're sick. So that'll be on sick leave. For cases related to, if you're just a contact right now, um, the recommendation is that you just do your normal activity, but you have to self-monitor yourself so that when you get, if you see your skin and you see that you have skin lesions, you're gonna have to self-isolate straight away. Okay, so that there is no recommendation that people who could have been exposed but not symptomatic, okay, that's called your contacts, right? People who thought that maybe they contacted someone, but they have no signs and symptoms. Right now, the recommendation for those people is that it's just business as usual. They just need to self-monitor themselves. And the minute they find that they have signs and symptoms like a fever, a rash, they will need to self-isolate because then they have moved from being asymptomatic to symptomatic. Okay. Okay. Yeah, testing, correct. So testing right now is limited to designated locations that WHO labs, the health authorities labs. Right now, the UN doesn't have capacity to do this soft testing. So you would need to set your UN facility would likely need to be sending the samples out to local health authorities, local WHO lab to get it tested. Certain countries obviously have more access to it, certain countries have less. Okay. Yes, we'll share the slides with you. Is there any training program available for the lab? So again, as I mentioned, the testing is a PCR testing that needs to be done by specialized lab. It's not a rapid test that can be done like, a dipstick or something like that. So these are going to be specialized lab. So I'm not sure that, our UN labs would be able to do these sort of testing right now. It should be in very specialized facilities. But obviously that's something that some of our colleagues are looking into. And as some of these tests become more readily available, perhaps things might change later down the road, but not now. Now we don't have the ability to do any sort of like rapid test or some easy test for it. What is the appropriate PPE to don when handling Mpox patients? Yes, so as I mentioned before, a lot of this is already in our risk mitigation plan. So if you're a healthcare worker handling an Mpox patient, the recommendation would be gloves, very important, like an apron, a N95 mask, and that's for healthcare workers only, N95 mask, okay? Some kind of eye protection, and then something for the feet as well to cover your feet, in case, there's cuts and somehow the materials get in. So that's for healthcare worker setting when you're handling an Mpox patient or suspect Mpox patients. Okay, other questions? Yes, so as long as someone doesn't develop symptoms, they should be functioning as usual, okay? Why does the disease have two different incubation period, 1 to 5 and 5 to 21 days? No, so the disease doesn't have two different incubation periods. There's a range, okay? And so the maximum is 21 days, and the minimum is, perhaps 3 to 5 days, because it does take time when someone is exposed to the virus to develop the signs and symptoms. So it's not like going to be like 0 to 21. So it does take a few days, but maximum can be 21. So there's always a range because different people, we're the host of the virus, our response can be different. Some of us are, stronger than others. Some of us develop the signs and symptoms quicker than others. That's why there's a range of incubation period. Okay. How can we confirm diagnosis? Yes, so it's a PCR testing. If you're a healthcare worker and doing the testing, just to say that you need to swab vigorously the skin lesion, and you need to deroof, means you have to get under the skin to be able to swab and take out some of the virus. So, it's just not like on the skin surface. You need to deroof it and get under it and then swab. So it should be a vigorous type of swabbing, okay? And it has to be sent to special lab. Yeah. If the person has already had Mpox before being vaccinated, is it true that they do not need to be vaccinated because they already achieved immunity? So, yes. So right now, I think the science is not very clear, but for sure, there is some level of immunity. If someone already had Mpox, they definitely have some level of immunity. It's not clear, how high that level of immunity is, as well as how long it lasts for. The same is actually true for smallpox vaccine. So some of us here who might be older, who have had the smallpox vaccine, that smallpox vaccine is also protective against Mpox, but it's not like 100% protective, okay? It's like there's a percentage. There's some people who have the smallpox vaccine before that still can get Mpox. So it's not very clear, but there is definitely some level of protection, okay? Can you provide the link for future meeting registrations? Yes, so we'll provide you a website that you can sign up for. We call it kind of the Public Health Conversation Series. And once you're included in a mailing list, we will send you notes about our future meetings just like this. Okay. And typically, I don't speak. We really invite other experts to come and speak to the program. But for this special case, I thought that it's better that I speak to you guys directly about Mpox. Have there been reported cases of Mpox among UN personnel? So right now there is just one lab confirmed case, but we're continuing to monitor the case as well. And otherwise, there are no other cases reported so far. Um, Please comment on stigma and mental health in relation to Mpox, especially at UN context. So yes, there is some discussions around stigma with regard to Mpox, primarily because I think, as I mentioned before, there's one of the risk factors for Mpox is related to sexual activity. So, for example, in the 2023 and 2024 outbreak right now in the DRC, the three main groups that are really affected are children, and then sex workers, as well as men that have sex with men. Okay, so this is probably why there is that kind of talk about stigma. So it is important not to stigmatize anybody because, these viruses really don't respect anybody. For example, I mentioned in 2003, Mpox was affecting people in the US who were pet owners of prairie dogs, right? These exotic pets. So just to say that, we're not really trying to stigmatize anybody by identifying, these risk groups. But it's also important that we know these risk groups so that, WHO, the health authorities can really get the information to the people that need it, right? So there's a balance, I guess, in terms of identifying the risk groups versus stigma. Okay. Um, can you mention about the risk of illness and special care in children under 15 years old? So, in the DRC situation, this current outbreak of the clade 1B, there is seen that it's affecting children a lot. I don't think it's under 15. I think it's younger than that. Like I said, under 8, under 5. But those groups tend to be more vulnerable because they tend to, are just younger and, probably need time to build their immunity. So, that group, the immunocompromised group, the pregnant women group, so those groups tend to be at risk of more severe illness, okay? Just to say that there's a difference. When I say risk groups, there's a difference between uh, the people who are at risk of severe disease, okay, at risk of death, at risk of complication, right? That group is the immunocompromised, the young children, as well as the immunocompromised, the young children, and what was the third one? So those were the groups that are more prone to complications. And the pregnant women as well, pregnant women and breastfeeding women. Okay, so these three groups are more prone to complications. But the risk groups that right now are more prone to getting the clade 1B are those groups that I mentioned just now. Okay, the also the children, men who have sex with men, and then the sex workers. Those are the seem to be more what we're seeing in the current outbreak. This, of course, may change as well going forward. These sort of epidemiological factors may change as we learn more about this disease. When we talk about hygiene practices, is it necessary to clean surfaces and sanitize rooms? Should hospitals have specific treatment area? So actually, we are in the middle of putting together a clinical checklist for all our UN facilities. So that checklist will help you to go through. But it is important, of course, that every health facility have a isolation room And this is not just for Mpox, like any disease, someone coming in, very sick, coughing, sneezing, they ideally should be isolated and set apart from other people anyway, because they could have a infectious disease that could spread to other people. So, I would say all of our healthcare facilities would be having a isolation room that they can just quickly isolate people when necessary. So yes, and in terms of cleaning surfaces, there's nothing special for Mpox that's needed for healthcare facilities, but it should be clean and sanitized as per your usual, using your usual disinfectant, using um, the 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 regular protocols that you use for cleaning a hospital. Okay, we have all that in our risk mitigation plan as well. WHO has a lot of guidelines as well with regards to cleaning and sanitization, so you can look at that as well. Question mark, do we quarantine contacts of suspect cases or confirmed cases? So again, the same thing. Okay, what was quarantine? Quarantine is different from isolation. Okay, isolation is when someone is sick with signs and symptoms and you need to isolate them. Like I mentioned just now, isolation room. The term quarantine is basically for contact. So people who haven't got the disease, right? You and I, that we know that we may have encountered someone with Mpox, or we were told that we encountered someone with Mpox, but we haven't developed the disease yet. We're absolutely fine. And so during COVID, for example, there was a lot of quarantine of contacts, right? But in Mpox, there is no recommendation for quarantining a contact. So a contact who have no signs and symptoms of disease, who are normal, it's just that they were told that they could have been close to an Mpox person and just need to self-monitor. They just need to self-monitor. They don't need a quarantine for now. Okay. Is the virus something that can mutate into something more serious? So basically I mentioned these clade 1A, 1B, 2A, 2B. And the differences of these viruses is these mutations, okay? And in fact, clade 1 is already a little bit more serious. Like I said, more transmissible, has a higher death rate compared to clade 2. Okay, clade 2 is like the milder one right now. Okay, and then within clade 1, the clade 1B is right now, it seems to be, creating more serious disease as well. So it is hard to say if it will mutate to something more serious, but obviously, viruses are kind of always mutating, and that is something that WHO is constantly surveilling and watching for, and they will definitely be on the lookout for this, whether there is going to be mutating to something more serious. Okay. And when or if it does mutate, the virus characteristics will change, meaning that if it could mutate to something more transmissible, easily transmitted. It could mutate to something that causes more severe disease, or it could be stable as well. Okay, it's hard to tell. Or it could, it could stabilize and not cause anything worse. Okay, so there's a space that we have to watch out for. Are there severe complications of Mpox? So yes, like I said, the more often the complications would be pain and itch from the skin, but yes, it can create more severe complications like bacterial infection, encephalitis. They were seeing a lot of that in children in this current outbreak, pneumonia, dehydration. So yes, there can be, but like I said, the more common thing that people are hospitalized for tend to be pain and itch from the lesion itself. Okay. Okay, how do we differentiate between Mpox and chickenpox clinically? So this is more for healthcare workers, but essentially the Mpox tends to evolve all at the same time. Okay, whereas some of the other ones like chickenpox, they the lesions or the rashes they evolve at different rates, but Mpox tend to kind of your whole body tends to have it all at the same time. So, it all becomes like pimple-like, and then it all becomes like umbiliculated in the middle, and it starts to crater. So this kind of development tends to be more even throughout, whereas other rashes, may have different cycles. Some may have scab over already, some are still in the pimple stage, some are so that's one of the characteristics, but nevertheless, it's very, very hard to tell. So testing is very important. Okay. After getting Mpox, how long will the acquired immunity be? So as I mentioned, we don't know actually. We don't also know how long the effect of a vaccination is as well. Is how long it lasts, okay? So it could be a few months, it could be years. We have to wait for studies to show us that. Okay, what are the effects of an infected fetus? Do they have long-lasting effects? So again, I don't think that people have studied this enough to know yet, but what we know is for sure that a pregnant woman can transmit this to the fetus, and there have been cases of miscarriage as well from women that have Mpox, where the children is miscarriage. So there are some of those kind of effects. So that is definitely one transmission mode. Okay, we call this a vertical mode from the mother to the child. It's a vertical mode. It does occur. Okay. Can the Mpox virus droplet suspend in the air? Is transmission possible? Uh, so, like I mentioned, the transmission of this is not airborne, okay? And when we say airborne, typically it's because the droplets are so small that they become very, very light and they start to travel in the air long, long distances, okay? So there are some diseases, airborne diseases that do that, okay? But it's not in the case for Mpox. So Mpox is something that has this big droplet, okay? And like I mentioned, it is you have to be in close proximity of the person and for a long time, like I think a minimum of 4 hours, for example. And where the droplets potentially, when you're talking to a person, it kind of, you know, um, you have contact with your mucosal. When we say mucosal, we mean like, for example, the eyes, the mouth, it kind of touches your mucus, it goes in. Okay, so it's not something that is suspended in the air for a long time, traveling for a long time. That's not how this spreads. Okay. So for breastfeeding mothers, would it be okay to recommend to continue breastfeeding with standard precautions, hand hygiene, covering the lesions with pus? So currently, for Mpox, people with Mpox, with mothers with Mpox, um, I do not think that they would recommend to breastfeed the child because there can be transmission. Okay, I need to check back on that, check on that again, but I'm pretty sure that it would not be recommended because of the risk of transmission. But if you're a regular person, you don't have Mpox, you don't have any signs and symptoms of Mpox, it is absolutely fine to breastfeed, okay? So breastfeeding is very, very important for your children, okay? Can Mpox be a new pandemic? So, again, we don't know. Obviously, things can mutate and all. But just to say that when the WHO highlights a disease as a public health emergency of international concern, one of the main reasons for doing that is to try and raise awareness and try to corral the international community and countries together to put in resources, to develop vaccine, to develop treatment. So that's one of the main ideas of why WHO does this, okay? To signal to the world that this is an important disease, that we need to come together and deal with it before it gets worse, right? So you might have seen in the news recently that a lot of vaccines were donated to the DRC, from the US, by Japan, all that, a lot of donations are coming in. So, this was based on, the effort of declaring it PHEIC, allows those kind of efforts to happen. And then manufacturers start to also gear up, as they get to have demand for the vaccine, they start to be more willing to create the vaccine as well. So what I'm trying to say is that declaration of the PHEIC does not necessarily mean that it's going to turn into a pandemic. It was just a signal that it's an important disease. We need to come together to tackle it before it gets worse. Okay. All right. Let's see what else we can see. Can dogs or cats be infected? That's an interesting question. I mean, I assume that they can be. I'm not sure we have much studies around that, but again, like I said, that a lot of the reservoir of this is in the wild rodents, small animals in Africa, for example, in Ghana, in different parts of Africa. So it's kind of resident. It's a zoonotic disease. It's an animal disease resident in those small animals. So um, a lot of the early disease was really through exposure to these small animals, whether eating them, hunting them, skinning them, all these sort of things that cause kind of direct contact with the Mpox, and then the humans acquired it like that. Okay. Okay, so I think we've covered a lot of questions already. Are children living in the regions for high pox prevalence considered to be high-risk groups and prioritize vaccination? Yes, I believe so. I think different countries may have different kind of risk groups as well. So in the DRC, children would definitely be prioritized by the WHO, but a lot of this is the local WHO is working now with health authorities to determine who should be getting these vaccines to prioritize them. Okay. Okay. Let's see. The actual fatality rate of clade 1B. So right now, I think in general, what I've seen is that the clade 2, for example, in West Africa, it's something like around 1% case fatality rate. And then the clade 2, sorry, that's clade 2. Clade 1 with a high mortality rate can go up to, it's a range maybe up to 10%, something like that. But just be aware that this is because right now there are probably many cases that were not diagnosed, right? That, people have a rash, they don't go to the doctor, they just live, they just stay at home and then deal with it. So the underlying denominator could be very small, right? As more people become aware and test for it, we will see the denominator of this case fatality rate grow bigger. And as the denominator grow bigger, the numerator is going to grow smaller, and so the whole case fatality rate is going to go less. Okay, so I think it's a matter of time, that this case fatality rate will be, more clear. Right now, it's really not clear. Like different pockets, different countries, different pockets of endemic areas have different case fatality rate as well. So it's kind of a range, basically. So can the rash leave permanent mark? Yes, it can rash. It can leave permanent marks on the person. That's possible. Yes. Should all personnel going to DRC on mission be vaccinated? Again, right now, we don't have that recommendation that everyone going to DRC should be vaccinated. The vaccine is limited right now to the people who need it right now. And also within the UN, for example, in headquarters here, we don't have access to the vaccine. If you are in the US where probably their vaccine is available, you can go and ask your healthcare provider and see if they would give it to you. But right now, there is no such recommendation. Okay. Okay, the tests for sensitivity and specificity of PCR tests. So yes, so it's PCR tests are tests of the genetic material of the virus. So it's super sensitive. Like it's more than 95%. Okay, so it's very sensitive. So if you have a positive, it's unlikely a false positive. It's most likely a true positive because it's such a sensitive test. Okay.
All the questions are answered in chat, Esther.
Yes. If Mpox acquired by staff through occupational exposure would be considered service incourtesies or accidental. Interesting. So, I think that there are normal channels that such claims will be made. I'm not expert in this area, but then I think you just need to, if you determine that your Mpox was acquired through occupational exposure, for example, you would then need to just go through the normal channels for getting that. Okay, so I think we've covered all disease, all questions already. So thank you for your time. It's 10:01. And if you have any questions, please feel free to email us. Erin, do you mind putting the email address there? You can also email me at this email address. But thank you for your time, and I hope we help to address many of these questions. And if you'd like to, feel free to share this video with any of your colleagues or anyone that you think might be useful. Okay. All right. Thank you, everybody. Have a good day, and I hope this was helpful and assuring to all of you. All right. Take care. Okay. Bye-bye.